topic today is just looking at how we assist people with medication, a few things around personal care. And I know that all of you have already been doing this. And so some of this you're going to go, oh, I'm already there. But we wanted to make sure that we had some actual kind of best practice and protocol to make sure that we're all on the same page. I don't think Options had a very regular training on this. Some of you probably are saying, we've never had a training on this. That's possible too. But it's 2021, and so we're going to do things a little bit differently. Let's see. Now, I can't see every single person, but how many of you are assisting your consumers with medication? Show of hand. Okay. How many of you are doing lifting or transferring of the person that you're supporting? Okay. How many of you are helping with personal care? So things like brushing teeth, bathing, shaving, that kind of stuff. So this is part of our job, right? It's a sliver. It's not the only thing you're doing, but I think all of us are assisting in some way. And some of you, this is a big part of your job, depending on the person that you're supporting. So it's just really important that we have kind of, like I said, the best practice. We're all on the same page in terms of what we should be doing. Now, obviously, every person that we support is different. And so it's impossible in this forum for me to cover how it's going to work for each individual person. So what I'm going over today is kind of like the minimum, the guideline, and there's going to be people that you do less for, people that you do more. An example of something that's really tailored, I'm not going to cover feeding tube or G tubes today. If you're supporting somebody that you're doing that, there is specific protocol and training around that. And so I'll be sending out a video link, that covers the best practice around that. So, I won't be able to answer all of your questions, and that's kind of the next thing I want to talk about. I am clearly not a nurse, but I have been doing this a long time, and I did work with a nurse in putting this training together. So you may have a question that I don't want to answer because I want to check first. I want to know, well, what does that particular consumer need? What has the history been? What does the doctor say? What does the physical therapist recommend? So I'm not, if you ask a question, I'm not dodging it per se as much as I am wanting to make sure that I get you the right information. All right, so we ready to dive in? Can I see some thumbs up? Awesome. Okay. So what I'm going to do is I'm going to share my screen. I have a PowerPoint and I have some videos. Sometimes this goes really smooth and sometimes it doesn't. So there'll be times when I have to stop sharing and go find a video to show you. And you will see my very messy desktop. So I just apologizing for that right off the bat. Okay, hopefully you guys can see my screen. Can I get a thumbs up from somebody to tell me? Bruce, I can see you on my screen. Can you give me a thumbs up if you can see my? Okay, thank you. So now that I've shared like this, I can only see a couple of people, so bear with me. Okay. So just really quickly, some of your roles in helping our folks with their health and their well-being. First is advocacy. Many of you are already doing this, making sure they're able to say that the needs that they have, speak up when they go to the doctor, talk about how the medications they're taking are feeling, so you have that advocacy role. Then we're helping with medication administration. We're not a licensed facility, so this term, is a little loose here, but if if you are reminding the person to take their medication, if you're physically handing them the medication, you are taking part in medication administration. We obviously have a role of documentation. We're going to talk a little bit about that. There's several different kinds of documentation. We have safety and standard precautions, which we are going to talk about today. So that's a really important role that you have. Some of you, like we talked about, are helping people with transfers, and some of you are doing personal care. So we're going to start with looking at the personal care. And what I'd like to do is show you a video. And this video, I don't know if you can see this, it's 45 minutes long. We're not going to watch a 45-minute video, but I am going to send you the link to this entire video. It was put together by our sister organization, Compass. They worked with a kind of a home care, home health agency to put this video together. So they probably won't mention a specific agency, and this is of course not tailored only to options. This is more of a general video. So I want to start, let's see, right about.
Your role as a caregiver carries with it a code of conduct that requires consideration of general ethical standards. Ethics is knowledge of what is right conduct and wrong conduct. Morals are an important aspect of ethical standards and should guide your choices or judgments about what you should or shouldn't do. You should always act in a manner consistent with these codes, including respecting each person as an individual. Know the limits of your role and knowledge. Only perform tasks you've been trained to do and work within the limits of your role. Other conduct codes include loyalty, dependability, trustworthiness, empathy, protecting client confidentiality, and adhering to your company's policies and procedures. The individuals you care for have the right to feel safe and comfortable. Understanding your role as a caregiver will help ensure you increase your client's quality of life and will make your job more rewarding and enjoyable.
Okay, so as the first little snippet, just going over basic code of conduct. I'm sure none of that was surprising to you. Ethics and morals, respect, which is reciprocal, knowing your limits, knowing the limits of the person that you're supporting, doing the appropriate tasks, working within your role. For example, there are things that we're not trained to do that we'll have a medical professional do. So working within your role, loyalty, dependability, trustworthiness, empathy, confidentiality, and then adhering to policies. All right, I'm going to jump to the next little snippet.
You may be tempted to perform every task for your client, especially if you see someone struggling or feel that you can provide a service quicker and more efficiently. It's important to allow your client to perform as much as possible. Promoting independence will help preserve your client's strength, dexterity, dignity, and self-worth. We all have certain routines and specific ways in which we dress or brush our teeth. We all want to live life according to our desires, so it's important to communicate about needs, wants, and routines. Spending a little time sitting with your client and working on a care plan to discuss concerns and abilities will be beneficial to all parties involved. Before any interaction with a client, you must have a fundamental understanding of infection control. To understand infection control, we must first know a thing or two about infection. Infection is caused when there's an invasion and multiplication of microorganisms in any part of the body that then causes damage or disease. Invading organisms can be bacteria, viruses, fungi, or parasites. There are all types of infections, but preventing them can be done by practicing effective infection control measures, such as washing hands, wearing gloves, and applying the proper protective equipment. Although the body has an amazing immune system, many of the clients you'll be working with may have weakened immunity. Following safe and effective infection control measures is the #1 thing you can do to minimize infections. The first and perhaps most overlooked infection control measure is hand washing. Hand washing is easy to do, right? Well, then why don't we do it correctly and effectively? Are we lazy? Do we just not have the time? Do we not understand its importance? Really, there's no excuse for not washing our hands. We should be washing our hands multiple times per day, especially before and after providing direct care. Here are some hand washing guidelines. Wash your hands when they are visibly dirty or soiled with dirt, blood, or other body fluids. Wash your hands for at least 15 to 20 seconds. Wash your hands after touching certain potentially contaminated objects, such as bed rails or personal care items. Wash your hands under warm, running water and use a pump action soap dispenser. Avoid using excessively hot water, as you could burn yourself. Rub your palms to work up a good lather. The rubbing action helps remove microbes and dirt. Pay close attention to areas often missed during hand washing, such as thumbs, knuckles, sides of hands, little fingers, and under the nails. Clean your fingernails by rubbing the fingertips against your palms. Use a nail file or orange wood stick to clean under your fingernails. Keep nails short, as germs grow easily under the nails. To dry your hands, use a paper towel. Then use that same used paper towel to turn off the faucet to avoid recontaminating your hands. Then throw away the paper towel. Alcohol-based hand sanitizers are effective against harmful microorganisms as well. Don't use hand sanitizer if your hands are visibly soiled. Instead, wash your hands under a faucet. If your hands are easily dried out and get chapped, it's okay to apply hand lotion or cream to keep your hands moisturized. When excessively dry hands get chapped, they can become a portal of entry for harmful organisms. Wearing gloves is something you'll do many times throughout your shift. Gloves are used for tasks that put you in contact with body fluids, mucous membranes, dirty and contaminated surfaces and equipment. To remove gloves, perform the following. Grasp just below the cuff on the outside. Pull the glove down over your hand so it's inside out. Hold the removed glove with your gloved hand. Reach inside the other glove. Use your first two fingers of the ungloved hand. Pull the glove down, inside out, over your hand and the other glove. Throw away the gloves in a designated waste bin. Wash your hands. Those are the basic elements of infection control. Remember to always practice these measures so you can protect your client and yourself from infection and disease.
Okay, so just really quickly, I want to comment on two things. One, he said wash your hands when they're visibly dirty, when you touch certain fluids. But I want to reinforce that you should be washing your hands a lot more than that. We want you to wash your hands when you get to work. We want you to wash your hands before and after you put gloves on. You should be washing your hands a lot. That's probably one of the most effective infection control tools we have. And then my second comment is just about the gloves. If you are low on gloves, please let us know and we'll make sure we get gloves out to you. And I do want to let you know that a large shipment of the gloves that we got say large on the box, but they fit more like medium. So if you said we need medium gloves and large arrived, please try them because a lot of them are fitting a little bit more like mediums, which is why we might be sending you what looks like the wrong size. If any of you, want to spend time talking about that glove, putting on, putting off technique, I can spend some extra time afterwards if anybody needs help with that. All right, we're going to do another little section here.
Now let's talk about the specifics of providing personal care. Each individual's personal care regimen is unique and should follow your agency's treatment protocols. Some aspects of care can only be provided by a licensed medical professional. Be familiar with your client and your company's policies regarding specific treatment protocols. There are 4 principles of practice of care that must be followed every time you provide personal care services. Principle 1. Ensure quality of life by performing the following. Maintain privacy. Communicate what you are doing to protect dignity. Protect your client's right to personal choice. Ensure that the physical environment and ambient temperatures are comfortable. Principle number 2. Pre-procedure activities. Be prepared by performing the following. Gather supplies. Wash hands. Wear personal protective equipment as the task necessitates. Principle 3. Performing the procedure. Either follow generic and accepted practices of care or follow your agency's specific policies regarding the procedure. Principle 4. Post-procedure tasks. These include performing the following. Clean and return items to their proper place. Clean the environment, such as the bedding, bed rails, and other soiled equipment. Remove gloves, cleanse and/or throw away soiled items.
Okay, so that was just really basic. And I know you have more in-depth protocol for each person, but we just were going over the basic principles there. So I want to show a section on bathing. And it's really not going to talk about how you put somebody into the shower. Hopefully you can't hear that. We've got some commotion outside of the office. I love working in Midtown. Anyway, sorry for the distraction. So we aren't going to show, the difference between, say, a bed bath, a sponge bath, and a full bath. We're just going to talk about the basic guiding principles and know that we have to tailor that depending on what the specific person you're supporting needs.
Bathing is an essential aspect of daily living. Bathing cleans the skin, along with mucous membranes of the genital and anal areas. It is a very personal and private activity. Some individuals with developmental disabilities and those with other cognitive disorders may have difficulty distinguishing between who can and who can't touch them in a bathing setting. Providing personal care must be thoroughly and carefully planned so that clients aren't under the misapprehension that it is permissible for strangers or outside members of the care team to touch them. Consent must be granted, and specific bathing protocols should be drafted and followed. Never force someone to be touched when providing personal care. There's a lot to consider before ever placing hands on a client to provide bathing services. Bathing is an essential activity. It not only helps maintain health and safety by cutting down on harmful microorganisms, it helps us feel clean, fresh, and maintains our self-worth and dignity. Depending on the individual's needs, bathing practices vary. Some might only need to be assisted very minimally. Others will need complete and total assistance. Remember to follow the 4 principles of practice by
ensuring quality of life, conducting pre-procedure activities, performing procedure activities according to protocols and plans, performing post-procedure tasks. A few additional considerations when providing bathing is to assist your client with urination before bathing. Oftentimes, the warmth and relaxation of a bath can cause an individual to urinate. Cover your client for warmth and privacy and only expose areas that absolutely must be exposed. Make sure the water temperature that you use is comfortable. Wash areas from cleanest to dirtiest. Rinse the skin thoroughly and remove all soap and residue. Pat the skin dry to avoid irritating or breaking the skin.
These are the general rules of providing bathing. It's critical to follow them each and every time you perform personal care activities. There are several methods of bathing that can be performed based on your client's needs.
All right, so that was just quick principles about personal care. And I want to show quick principles about transfers. Again, this isn't going to go through all the different types of transfers because we've got kind of a big range, right? You have people that you're just providing standby, you have people that are using transfer poles, people might be using a sliding board, might be using a Hoyer, lots of different, right? So we're just going to go over some of the basic body mechanics of transferring. And then hopefully there's specific training for how to do it with the person that you're supporting.
To perform safe and effective transfers and client positioning, we must follow 3 steps before ever touching the client or object. The 3 steps are thinking ahead, preparation, and communication. Thinking ahead involves you assessing your client's positioning and movement needs, understanding their dependence level, and then formulating a plan and strategy. Step 2 is preparation. During this step, you'll gather all of your necessary equipment. You'll also clear any obstacles or hindrances that may get in the way of you properly moving or transferring of your client. Step 3 is communication. Communicating with your client is a key element in providing safe transfers. Proper communication involves the following: speaking slowly and clearly, telling your client exactly what you plan to do, giving one direction at a time, checking in to see if your client is comfortable and free of discomfort or pain. Make sure you follow these 3 steps each and every time you assist with positioning or transferring of your client. When performing transfers and assisting with positioning of your client, correct body mechanics must be utilized. Follow these general rules of proper body mechanics. Keep your body in good alignment with a wide base of support. Use an upright working posture. Bend your legs, not your back. Use the larger and stronger muscles in your shoulders, upper arms, thighs, and hips. Always keep objects close to your body when you lift, move, or carry them. Avoid unnecessary bending or reaching. Face the object or individual you'll be moving or lifting to avoid any unnecessary twisting. When possible, push, slide, or pull heavy objects rather than lifting them. Pushing objects is easier than pulling and puts less strain on the body. Use both of your hands and arms to lift, move, or carry objects. Turn your whole body when changing directions. Move and turn your feet in the direction of the turn, avoiding twisting of your body. Make sure your movements are even and smooth. Always ask for help if moving a heavy client or object. Bend your hips and knees to lift heavy objects. Straighten your back as the object reaches thigh level. Never lift objects higher than chest level. Do not lift above your shoulders. And if an object is higher than your chest, use a step stool or ladder. These are the general rules of body mechanics, and remember to utilize them each and every time you attempt to transfer, move, or position your client.
Okay, so that was pretty general. I will send out the link to the full video for both of those. So, and in these videos, it does show Hoyer use. It does show how to give a bed bath. You know, it goes into a little bit more of those details. But because we have so many different people on with, and not everybody are doing each one of those things, I only chose to show the general portions of that. The next thing we're going to talk about is COVID and the pandemic. So before I move on to that, if somebody has a general question about what we've covered so far, which is just some of the basic principles of your role in providing this type of assistance, a little bit about personal care, and a little bit about body mechanics for transferring and lifting. Unmute yourself if you have a general question.
I have a question.
Sure.
One of my clients, I try to get him to do more for himself, and it seems like more and more he wants me to do things for him. What are techniques I can use to get him to be more independent as opposed to depending on me to do things I know he can do?
Sure. Wonderful question, Natalie. Each person's different, right? Like, your folks. Something that I've used before, it's not going to work on every person, but where I say I can't for some reason, like I might say something like, oh gosh, I can't reach, my arm is so sore. I cleaned the garage this weekend. Can you help me? I'm really stuck. It's not going to work every time with every person, but sometimes I'll say I need them to do it for me because I can't. And a lot of the people we support, they genuinely care. if you're hurt or you're sore or you're tired. And that may help. There are some people you can say, I totally forgot how to do that. There might be other people where you can do some type of incentive for them. Some people you can have the honest conversation about, there's a few of our people you can be really real and raw with and be like, seriously, dude, I know you can do this and you're just trying to manipulate me. You can't do that with everybody, right? So those are just a few things, but I think your question would be really useful in a team meeting. So you can talk about, hey, is anybody else experiencing this? What have you tried? And then if you're still having issues, if I know the specific person and I'm making a guess about who you're talking about, we can also sit down and use a tool that I call 4+1. And it's just where we look at what are all the things that you've already tried? What are the little things that you've learned? And then based on those, what's the next thing we're going to try as a team? So great question, Natalie. Time for one more question. Somebody have another general question? Okay. I'm going to move on then. And what I wanted to talk about was some pandemic COVID related stuff. I have a short video I'm going to show about masks and just making sure you feel comfortable with donning and doffing them, putting them on and off. But what I wanted to do quickly was just make sure that you've all seen the last COVID memo that went out. It went out before Christmas. I am emailing important memos like that, and then I'm doing a QSP announcement so that when you clock in, it says, hey, you need to make sure that you've read this, because most of what we're sending out is too extensive for text, but it's really, really important. So I'm urging you to check your email frequently. If it's really important, like I said, I will do a QSP announcement also. But I will just tell you that I know you guys are paying attention to this. I know you are following it, and it is weighing on you. We have a high volume of pandemic related calls right now. We anticipated that the holidays would put people at greater risk, and we're seeing that to be 100% accurate. The pre-holiday calls that we were getting and the post-holiday have tripled. So I just want to remind you about the specific protocols right now. I'm going to go through it quickly because you should already be doing this. But one, the symptoms check every time that you clock in. It's important that you're really doing that and not just answering the way you think we want you to answer. If you are experiencing any type of symptoms, we want to talk to you and we want to figure out what our plan is together. The last memo said, reinforced, you should be wearing your mask while you're working if you can't be more than 6 feet apart. So a couple people I'm seeing on who are working today, thank you very much, because I see your mask and that makes me feel really happy. Some of the potential exposures that are going on, Mitchell, can you mute yourself, buddy? Thank you. Some of the potential exposures that are going on, if we had been wearing a mask while we were working, probably wouldn't even be a concern. So it's our most important step right now. And I understand that while you're working, it might not be comfortable. It's usually a fairly casual environment, so it feels weird. You need to eat and you need to drink. So I get all of that, but I also know how critical it is that we're wearing masks. So if you're having trouble with that, reach out to me. Let's talk about it. But I want to make sure that you have a supply of what you need. You each should have an N95. It could look like this. It could also be in a package. I know that lighting here is not that great, but it could have been one like that that's kind of folded. But you each should have your own. And there should also be some extras at the house. If there are not, if you don't know where your mask is, then I'm very concerned. You need to know where it is. You need to be taking care of it. And if you need more, you've got to let me know. I have a good supply right now, but I can't say that that's always the case because ordering them has been a bit competitive because everybody's using them. You should also have at the house some surgical disposable masks. We do have a good supply of these, so if you guys need more, let us know. And then hopefully you also have a fabric mask, that you could use as well. And then in addition to that, the other supplies I want to make sure you guys have is hand soap, hand sanitizer, and then basic chemicals to clean. And, for some places, we're also providing, as much as we can, toilet paper and paper towels. So if you don't have those things, communicate with your facilitator. If for some reason you're not getting them, please reach out to me so we can make sure that you have those things. The other protocol is that we're asking you to make essential trips only when you're working, right? So communicating with your folks about, I know we want to do those things, but we can't do those things right now. So, we're eliminating as much of the risk as we can. And then when you're off shift, I'm asking that you are really diligent about following the CDC's recommendations and the regional stay-at-home order that we're still under right now. And then the last thing I'll mention before I show the mask video really quickly is that if you have a potential exposure, I have to have communication. Your facilitator will ask you a bunch of questions, and it's going to feel invasive. But just so you know, I have to communicate with the public health department and with the regional center around all of these potential exposures. We're actually being required to send a daily Excel spreadsheet to the regional center that captures every COVID-related thing that we're doing. It's a lot of work, but it's really important so that we can get their support if we have somebody that tests positive. So you can expect that if you've had a potential exposure, someone, could be me, it could be your facilitator, is going to ask you, when were you exposed? By whom were you exposed? What were the details of the exposure? Were you wearing a mask? How long was it? We're going to ask about specific time frames. We're going to work with you, if you need to get tested. And then when you do get tested, we're going to be anxiously awaiting, of course, as you will be, your results. If any of you have not had a COVID test yet, it is not as bad as what it was originally advertised as. I've had to have 2 so far, and it's not uncomfortable like they say. It's not, it's just different, right, than something you've done before. So I am telling you that we're going to expect and require a certain level of communication so that we can make sure we're protecting you, protecting the consumer, and protecting the team, because we've got to do that contact tracing and figure out, okay, how serious is this potential exposure and who is in that circle and what do we need to do to make sure we're keeping everybody as safe as we can. So hopefully, there's no issues around that. If there is, I do want you to reach out to me. Somebody just put a question in the chat about vaccination. And I don't know when that's going to be available, but what I can tell you is we have had conversations with the public health department about moving us up into either the current wave or at least the second wave. Because we're not a licensed facility, we're not included in the very first wave. However, I did just find out last night that IHSS has been successful in some counties in California, not all, in being included in the first wave. So San Bernardino, LA County, and Contra Costa County, their IHSS, they've partnered with somebody, and they're already offering the vaccine. So I put a call into IHSS. Of course, I wasn't able to talk to anybody. You've never had that happen, right? Where you call and they're not available. A little bit of sarcasm. But I put a call in to say, when is it going to be available in Sacramento County? So it's possible that you as an IHSS provider will be able to get it before we can provide it to you for options. I have had people call and ask me, will you require it? I cannot, by law, require you to get the vaccination. We will encourage you to. We will encourage consumers to get the vaccination, but I can't require it. So as soon as I have more information, I'll share that with you. So great question about the vaccination. Okay, so I'm just going to show you a quick video on putting on and off the mask. This is Janessa. If you watched our last all hands video, you got to see her, and you may have already seen this, but we're going to just show it really quickly here.
Everyone, my name's Janessa and I'm one of the nurses here at Compass. Today I wanted to take a couple minutes and talk about N95 masks. You may have seen a lot about them in the news or from information from the CDC or even here at Compass. And there's a few things that you should know. So we're going to walk through the when should you use them, the how do you use them or how to put them on and take them off, and how to take care of them in between when you're wearing them. So first up, a couple of reasons that you might be wearing them or the when you should wear them is when you have a client that's tested positive for COVID and they're quarantining at home. That's one thing. If you have a client that has been tested and is at home awaiting results of that test, you should also be wearing an N95. And the third reason is if you're visiting a client at the hospital or waiting at the hospital with a client who's at the ER or going to get admitted. Next, let's talk about how to use them. So there's actually a really specific process for donning or putting them on and doffing or taking them off. But before I walk through that, I wanted to point out a couple different styles, if you will, of N95s that you might see here at Compass. So the primary one is this greenish blue one. Okay, it also could be white. Color doesn't really matter, but this is probably the more prolific one that you might see running around. The second type is also an N95, but it actually starts out very flat, and you have to unfold it, and then it looks a little bit more like the first type. So when it comes to using those, the donning portion, one important thing, well, actually a couple important things when it comes to donning an N95 mask is considering what's around your face and your ears. So if you're wearing large earrings, you're going to want to take those out, maybe tuck them in a pocket because those can interfere with the straps, and I wouldn't want an earring to get caught. Same thing also is hair. So for those of us that have longer hair, we're going to need to put that up before we use these masks. And facial hair. While I don't have facial hair, there might be some of you gents around that do, and if that's the case, clean shaven is best. In order to get that good seal around the mask and not have facial hair interfering with that, being clean shaven is best. So I'm going to put up my hair real quick. Okay, now that my hair is up, we can go ahead and walk through the donning procedure. So when you have your mask, you'll notice that there is a metal piece that's above the top of it, and you'll want to orient yourself this way to the mask because the metal piece indicates where your nose is supposed to go. So that should be pointed upwards when you're putting it on. You want to go ahead and let the straps dangle down and put your hand through it. Okay, that way you're not fumbling around with the straps in a moment when you have it on your face. So if you cup it in your hand like this, you should be able to have a good grip on it and then go ahead and put it up over your face. The first strap you're going to want to put on is this top strap here. And this one goes towards the top of your skull, okay, or the top of your head. That gets pointed upwards. Next, you're going to want to pull the bottom strap up and over, and it goes actually down your ears. Okay, so it's going to go pointed down here. Everyone's got a different shaped head, different size head, so it may fit a little bit differently, but that's roughly the direction that both should go. So next piece you want to do is actually molding the nose. Okay, everyone's got a different size or shaped nose, so you'll want to make sure that it fits good to yours because that's actually an area that a lot of air could either get out or actually, get in without being filtered correctly. So it's important to mold the nose and then do a check of the seal. So if air gets in through the sides or gets out through the sides without being filtered from the mask, it defeats the whole point of the mask. So we're going to check to see if there's any air escaping. So what you want to do is actually hold your hands around the different sides of the mask here and breathe out. We're not feeling to see if the air is coming out here through the actual filtered portion, but escaping through the outward portion. If you don't feel any air coming out through the sides, you're good to go, and you can go ahead with taking care of your client with the mask on. While you're wearing the mask, you may notice that your voice is a little bit more muffled. So you'll want to talk maybe a little bit louder and a little bit more clear with enunciation, if possible, when interacting with your clients or other people. You may also notice that the inside of the mask feels very warm, even potentially a little claustrophobic. And if you wear it for long enough, it can make you feel very hot and a little bit oppressive. That's totally normal. If you've worn these for any length of time before, you'll know that to be true. But if it's the first time, it can be a little bit of an unusual experience. So when you've gone through the time that you need to be wearing this, and you no longer need to wear it, or at least perhaps you're away from the client for a little bit and you can take it off, it's important to follow some specific steps for taking it off. That way you're not touching the front of the mask, which might potentially be contaminated, and then touching your hair or touching other things, and then just kind of spreading all the virus around. So in order to take it off, you're actually going to want to lean forward, because we're going to start by removing the straps. And when the straps are dangling, you don't want the mask to actually hit you. So first things first, the strap that you're going to want to take off first is actually this lower strap. So we're essentially doing the donning process almost in reverse. So this lower strap comes out first, and that's the part, if you had earrings, it might get caught on. And next, so you've got this strap dangling, you're leaning forward a little bit. You want to take off this top mask, the top strap. And now you're able to hold the mask entirely dangling without touching the front of the mask with your hands. So now you can safely, if you're disposing of it, you can dispose it in a trash can. Or if you need to reuse it, you can actually grab your paper bag and put the mask in the paper bag for when you're ready to reuse it again. And the reason that we are providing paper bags instead of plastic or something else is simply because paper bags allow for moisture to evaporate. And there's potentially a lot of moisture from your breath that needs to be let off and go back into the atmosphere without being cooped up. If you were to put it in a Tupperware or something plastic, all that moisture stays inside and it's not good. So now that's the doffing procedure. And we also, inadvertently, we covered the how to take care of the mask in between wearing it process as well. So if you have any questions, please talk to your supervisor. I hope these.
Okay. Any questions before we move on about COVID or masks? Yay. Okay, so we're gonna move on.
One question.
Yes, Mitchell.
What if your consumer is kind of offended of wearing masks, of the staff wearing them?
So we want to have some conversations about it with them. And that's something I would be willing to do. You know, if they don't want you to wear a mask, we have a couple of options. One is I can have a conversation with them and see if I can figure out what the problem is, because there are people that have communication difficulties that I get where that could be what the problem is. I can also provide you with a face shield instead of a mask. That would help protect you, help protect them. It's not as great as an N95. There may literally be times though where it's not a choice, right? If we have a consumer test positive, there's no choice around that. If they're not willing to have us follow the protocol, they can't stay in SLS. They'd have to go home or they'd have to go somewhere else because we don't have options around that. But for a couple of people, I think a face shield might be preferable because you can see the expression, you know, but it is, hopefully we're getting to the place where masks have been normalized enough that people, I know in the beginning it was really a strange, awkward feeling. But if you are continuing to have those challenges, reach out to your facilitator, reach out to me, and we'll figure out what's going on with that individual and we'll try to get it addressed. Great question.
Okay, thank you.
Yeah. Okay, so just want to cover a couple of things here. First is just making sure you know that we are required to get consents signed by consumers in relations to disclosing information, getting, letting us provide medical treatment when necessary. And those consents are time limited. And so that's something I'm just making sure you're aware of that. One of the main reasons for consents that I want you to be aware of it is because of confidentiality. It is possible that a consumer has not given us permission to share information with specific people. So it's good to chat with your facilitator, make sure you're aware if there's anything, you know, any kind of specific situation like that with the person that you're supporting. So we have a medical appointment form, and I don't know how many of you have seen this before or if you're aware of it. You know, we are transitioning into, you know, basically a fully virtual mode. We're going to talk about QS Med today. and transitioning from paper tracking for medication administration to a virtual electronic tracking. So in that same vein, we can transition and will transition from a paper form to keep track of medical appointments to using QSP and QS Mobile to track medical appointments. The most important thing for me is that we get the information about medical appointments. So if you can't figure out for some reason how to use mobile and you're feeling stuck about it, use the paper form. If you don't have this paper form, use some paper. It's just really, really important that we're getting information from when an individual goes to the appointment, especially if, you know, the facilitator wasn't involved with the appointment. You're the one that's there. You're helping them to understand that information. It needs to get passed on to the rest of the team. And certain things we have to document in quarterly reports, annual reports. And then, of course, we want to make sure that any of the post-care recommendations are being followed. So this is just a snapshot of the form. It has basic information about the individual. When you use the form in QS Mobile, a lot of the information automatically populates, and you won't have to look up things, you know, that the doctor might be asking you for. Specifically, there's information here about if there's a prescription change or a new prescription, and that's one of the most critical pieces of this, is making sure that you get this information to the facilitator as soon as you can, because QS Med and being able to electronically sign off that we've given medication will only be as good as the data entry that we have. So if you take somebody to an appointment today and they want to increase the dosage on a medication and they want that to start this evening, the facilitator has to get in and make that change in QSP, and that way it'll show up in QS Med for the next time that that medication is being administered. So the timeliness of this communication is really, really important. The other thing that's important about this is getting like the details from the doctor about both the prescription and whatever they're saying. Like if they're saying, we want you to make a dietary change, or we want you to have a specific follow-up. When I go to the doctor with an individual, I will sometimes ask the medical professional, hey, can you actually type this in for me? Because I don't want to get it wrong. You know, I don't want to mess it up and then have it given wrong because I heard you wrong. That's the equivalent of saying, I need you to write this out. Most places are giving you an after visit summary. I love that, because then they're putting all of the instructions in the after visit summary. So that really helps a lot. Let's see. Okay, so you can access this in QS Mobile. And you know, I just realized I don't have a video to show you about that. So that's something I'm going to have to send out to you, because there is a video that shows you how to use that. So I'll make sure that you get that. Okay, I think that's it, unless there's any questions about medical appointments and medical appointment forms. So just going into, you know, this concept of administering medication, helping people with medication, we just want to be clear about what we're actually talking about. And even though this is supported living and we're supporting people in their own homes, because we are assisting people, we do have some rules that have to be followed. And so when we talk about medication administration or assisting people with medication, we're talking about both prescription and non-prescription drugs, medication, pills, what have you, treatments. If it's over the counter, we still have to keep track of that. We still have to be aware of that, and it still counts in terms of medication administration. So we actually are going to be, you know, wanting a prescription or the doctor to acknowledge, you know, that something is being taken. If it's being taken by mouth, if it's a topical or an external, say a cream, if it's something that's inhaled, or anything that we're putting into a feeding tube, or of course anything that's being injected. If we're using a feeding tube or doing injections, we're going to want a separate training. So if you're doing that, we're going to want to make sure that we provide you with that training. So next thing I want to cover is PRN, or as needed medication. So as I mentioned, we want to have a prescription or at least a written acknowledgement from the doctor for everything the person is taking. So a PRN, could be something like aspirin or ibuprofen for pain. There are certain medications that people take maybe for anxiety. That could be if you need an extra dose, maybe you're already taking it, but you have the ability to have an extra dose. Or maybe you have one that's just for if you get super anxious. There's also PRN sometimes for sleep. There could be lots of different reasons for PRNs. But it's really important that you know what are the guidelines around PRNs. Usually the PRN will say up to this many times per day or up to this many milligrams. You have the flexibility. But if it's something that you bought over the counter, it might not be as clear, which is one of the main reasons we want to make sure the doctor has either prescribed that and gives us some guidelines for how to use it, or acknowledges. So when you go to the doctor and you say, hey, they have, seasonal allergies and they want to take an over-the-counter allergy medication, I want the doctor to tell you which one to take and what the parameters are, because the doctor and the pharmacy can help us understand how those two medications can interact and contraindicate. So it is possible that there are some negative interactions of an over-the-counter medication. It's possible that an over-the-counter medication can impact the way a medication works and make it less effective. So lots of reasons that we need to have really good documentation. So I want to make sure that any PRNs that you as a team have talked about, how do I know when to give a PRN? If the person says that they have a headache, do you just give it, or do you wait? Do you try something else like, well, let's lay down for a little bit, let's drink a glass of water, or is there some type of guideline that's agreed upon? This is especially important if it is an anxiety related PRN. The person is a little bit nervous, so you give it right away, whereas another person waits and they try 5, 6, 7, 8 different things before they actually administer that. So it's really important that you are all on the same page about when to give those PRNs.
Okay, I have a question. Can I ask a question, Melanie?
Yes, go ahead.
Yes. We got lots of PRNs, Jessica's,
Okay.
and her mom is the one just ordering us to give like this, give like that whenever Jessica complains to her when she calls.
Mm-hmm.
So I don't think we have like a doctor's prescription, because it was the mom who's just give this, give that, and we are just adding it to her meds, like
Sure.
the allergy medications and the vitamins.
Right. So
So, so
was
I
my
don't know.
that was my that was my question too, to Melanie. What if there's a conservator that has medical rights over the consumer, and
Yes.
they just do whatever they feel like they need to do?
So
Yes,
in
that is
those
true.
cases, very good questions. In those cases, if they don't respond to you as the facilitator having this conversation, I'll be happy to have this conversation with them. But what I will request is that at the next doctor's appointment, and right now it can be done telehealth, so it's not super difficult to do this, that there is a discussion that happens with the doctor where the doctor is aware of the over-the-counter medications, and we at least capture in a after visit summary that they're aware of that. If the family is not willing to do that, then I will have a conversation with them, because I will expect them to sign a release that says you are the one that's prescribing and you are not willing to have a doctor do that in tandem with you, and therefore that releases us from any liability related to that. So I'll need to work with that conservator to put in writing that, hey, our protocol is, and the regional center's expectation is this, you're saying you're not doing it that way, and we need to have some agreements and something in writing about it.
Yeah, and I also have an issue of that too, because right now she's okay, and then later on she calls mom, and then she will say something that she had a headache, even if she was fine. And I don't know if this is an attention seeking from her mom or whatever, but if she says something like that, I have to redirect her, but then she will just stick to the point that mom told me you have to give me this.
Right. So what I would like
So-
you to do is, Christina, as a team, I can give you guys a PRN protocol worksheet. And as a team, you guys can talk about that, where you say, okay, these are the current PRNs. This is what they're prescribed for, what they're supposed to be given for. When the person asks for it, this is how we're going to respond. We're going to try this, then we're going to try this, and we're going to try this. And that way we've got a protocol that we've agreed upon, and mom is aware that we're doing. In the end, if a conservator says, this is what we're doing, again, I'm going to have that in writing. And if it's something that we feel like is putting somebody in danger, then we'll handle that a little bit differently. So
Yeah, I'm scared of that because if she calls and then she was like talking to her mom, but she did not cough at all at that moment or before that,
yeah,
before calling her mom. And then she calls her and then she was like doing this and said, are you coughing? And then she said, yeah. Oh,
Yeah,
could
I
you
agree.
please tell
I
her
agree
to
with
give me a medication?
okay.
So
yeah, I
that,
agree with Melanie.
Yeah.
I agree with her too.
Yeah, I hear you. So because this is related to just one person that we're serving, it probably isn't. We probably have a few other people that have this issue as well. We want to deal with it and get a plan in place. And we, that's part of my job, is to be able to have those tough conversations with family members, with conservators. So that's something that I can do. But for the sake of time, I've got to move on to our next thing. And I'm going to make a note about this and follow up with Christina. And Christina and I will work on how are we going to address this. I'll need a little bit more information before I talk to mom. But it's a very good point, and it's something that we'll have to get addressed. So thank you both for bringing that up.
you're welcome.
Okay. Was there a quick question? Okay.
I had a quick question. What if the client is able to make their own decisions, and like they say they had a sore throat or whatever and they want to have a cough drop, and it's their own decision? Are they allowed to make their own decision to use it over the counter without us having to call a doctor?
As long as that is documented in their ISP, that we are not providing that type of support. And
Okay.
if we know historically that person does that, then again, at an annual physical, I would like the person to say, hey, every once in a while I want to take cough medicine. Is there a specific kind, and is there any contraindication that I should be worried about?
Right.
And if the doctor says, no, if there's no contraindication with your medications, then I'll feel better about that.
Okay. Thank you.
Great question. Okay, so I just wanted to cover doctor's orders very quickly, in that we want to make sure the prescription that we have, the order we have, is really detailed and complete, so that we are not guessing as to what we're supposed to be giving, how often. So this is an example of a complete doctor's order. I also am asking that you're aware of what people's allergies are, so that if you're at the doctor's appointment and the doctor is prescribing something, if you're aware that they are allergic to that, of course I want you to speak up. It should be documented in their medical record, but it has happened before where that's gotten missed, and a really perceptive staff has been the one to speak up and say, no, they have an allergy to that. And then the doctor will take a second look and go, oh gosh, you're right. Okay, let's change that. There could be abbreviations that show up in a doctor's order. And if you don't know what that abbreviation means, please ask. You know, I'd rather when a doctor is writing that out that instead of saying BID, that they actually write 2 times per day. Instead of saying PO, which means by mouth, you know, I'd like them to write that out as much as possible, since I don't want there to be any confusion around that. That's kind of part of that advocacy piece, is being able to stop a doctor, stop a nurse and say, I need more information and I need you to spell that out for us, because a lot of different people are going to be, you know, giving this medication. I want to make sure that it's right. So a couple of things about our role, your role, in regards to medication. You know, on the left-hand side, or it's my left on the screen, your role is, you know, to assist with whatever the person's medication regimen is, to work with knowledge and competency. So that means asking questions, knowing what the person's diagnoses are, knowing what their medications are. You don't have to have in detail committed to memory, but if you have to go, you know, to the emergency room, or God forbid you're in a car accident and you don't have all of the information, you should be able to say, this is Jessica. She takes a medication for blood pressure. She takes a medication for anxiety. I know she has a heart condition. Like, even if you don't have, you know, the official diagnosis, you should know enough about their, you know, medical snapshot to be able to give paramedics some knowledge. You know, there's certain things, if somebody's taking a blood thinner, for example, that's really, really important to be able to say. Even if you don't know the name of the medication, you know they take a blood thinner. So when we say working with knowledge and competency, it includes having that basic information. Part of your role, a very important role, is practicing standard precautions, and we are going to review what we talk about when what we mean by standard precautions or universal precautions. And then, of course, communication is a big part of your role. Letting us know how medications and how things are affecting the individual, letting us know when there's changes, letting us know when you have questions, letting us know when they have questions, looking, you know, ahead and seeing they're going to run out of this medication. I don't know who's taking care of this. I better call someone. Those types of things, you know, fall under communication. Now, when we say not your role, I know there's going to be some questions about this, but I don't want every single person filling a pill box or a tray. I know a lot of our people, their medication comes in the bottle, and then you're putting into, you know, the daily morning, afternoon, evening, PM, whatever. I want to, and I will launch a training specifically for people that have that responsibility. It should not be every staff's responsibility to do that, because the more people who have their hands in that box, the more chance there is for us to make an error. And many of you who are on today, I know firsthand you have actually caught a medication error because the pill box was filled incorrectly. So it's really, really important that we're going to provide some extra training around that. And that we, you know, the facilitators need to work with each team to say who is doing that. And let's make sure that we're on the same page about that. And if that person's going on vacation or isn't there, who is the next person that has this information, knows the person well enough, and can do this responsibility. So that's why I have that on the not your role, because it shouldn't be assumed that everyone does that. It is also not our role to decide to change something. So for example, if the prescription says 3 times a day, and let's say a better example is maybe a stool softener. Technically, we shouldn't be saying, oh, they don't need that anymore because they had loose stool, you know, 1 time. So we're just not going to give that for 5 days. One of us by ourselves should not be deciding that. We should have a conversation as a team. We should call the doctor. There should be a protocol. You may have a medication where the doctor has said, you have the ability to hold that, and here's when you hold that, but I want that in writing. So we don't get to decide, oh, we're discontinuing this medication, or we're going to add a medication by ourselves. Christina, I know you were raising your hand.
Yeah, I was just going to say, we do, though, want everybody in the house to know what medication, even if they're not filling it. I just wanted to say that. Okay.
Yeah. Yeah, and that's what you need to know everybody's medication, because when we get into actual administration, it is your job to know what is in that box. You know, when it says AM and you're giving AM medications, you don't just dump it and give it to the person. You have to confirm that everything that's in that box is what is going to be given. I know somebody else raised their hand and wanted to ask, but I apologize. I can't see everybody. So there's another person. Go ahead.
I did.
Okay.
I have a question about if, like, Anderson Brothers, I don't know if other pharmacies do, but they do bubble packs.
Yes.
And it's very important that, like, I know I work another job too, and we're supposed to check them, like, at the door. But I know, like, a lot of times nobody even unstaples if I'm not the one that's here when they come, and looks in the bag to make sure that it's even the medicines. But I know, like, when I'm filling the meds, that I have to be careful to look, because every once in a while they'll put like 2 allergy medicines in one bubble instead of just the one. And so if you're just dumping them in and you're not paying any attention, then you are the one making the error because they made an error. So it's very important to check, and you should always check at the door when you're getting a delivery and make sure they're even their medicines and that they're the right medicines.
Perfect. That was an excellent share. I was going to mention bubble packs or blister packs, whatever you call them, at some point, that, you know, even if you would think they'd be right because it's coming from the pharmacy, but as Candy pointed out, they have made errors. Sometimes the error is because there is a new prescription and it didn't get to the pharmacy in time before, you know, it was sent out. So sometimes it's more of a communication error, but it's still an error. Great point. Another thing that I want to point out is just that sometimes people have what we call controlled medication. So it's a narcotic, or basically a medication that has a street value, could be considered a controlled medication. So if somebody is taking a controlled medication, we may institute a different policy where we're having you count medications with the person when you guys change shift. That's not something we do all the time, but it is something we may need to do. So I just wanted to point that out. Okay, so I wanted to go over standard precautions. Standard precautions, or universal, you might also hear them called universal precautions. These are the things that we do to try to prevent the spread of infection. This is what we do to try to protect ourselves and try to protect our consumers. And we basically want to assume everybody has something, right? So that's why they're called standard precautions. We really don't know. And how ironic is that, right? Because that's exactly what's going on with the pandemic. We have people that are asymptomatic and you don't know. And it's not their fault, right? Because they didn't have symptoms. That's why we have to use standard precautions, and you just don't know. So the standard precautions that we're talking about, the first is your hand hygiene. That's why I showed you the video of washing your hands. And it seems like such a simple thing, but it's so, so critical. So having really good hand hygiene, that's the first step. The second is using your personal protective equipment that we're providing to you. So whether that's gloves or your mask, in some situations, we might actually provide you with a face shield or goggles if you needed that. If we have a situation where somebody tests positive, we will provide you with a gown and all of those other things that's necessary. And then sharps, which would be any type of needles. If there are sharps, which would be like syringes, needles, blades, lancets that you use for testing glucose, those types of things need to be disposed of properly. So there should be a sharps container, and there should be some protocol for how we do that. I have handled a workers' comp injury myself where a sharp wasn't put in a sharps container, instead it was thrown in the regular trash. And then the next person that went to empty that trash was poked by the needle. And so it's really important that we're handling sharps in a specific way, in a specific type of container. If you have sharps in your home and you don't have a protocol for that, please contact your facilitator, contact me, and we'll make sure that we get that. One other thing I just want to mention that kind of goes along with these standard precautions is just where and how we store medication and supplies. You know, there should be a routine spot, and they shouldn't be, you know, in heat or direct light. They should be out of the way. Everything needs to be labeled. You know, those things need to be kept clean and organized so that, you know, it's not contributing to distraction or potential mistakes. So when we're talking about helping people with medication, there's something called the 6 rights. I really hope most of you have seen this before, and this is not brand new to you, but it's important that we go over this. Every time that you're assisting a person with medication, there are 6 things that have to be right. 6 things that have to be verified in order to accurately administer or assist somebody with medication. And it is each one of our responsibilities to make sure that these 6 things are right each and every time. So we are going to go through these. Sometimes it wants to advance and sometimes it doesn't. Okay, so these are the 6 rights. We will go through them individually, but we're talking about the right client or right person, right time, right medicine or medication, the right dose or amount, the right route or route, however you say it, and then the right documentation. Now, I just want to talk about, before you get into giving the medication and going over the 6 rights, you want to make sure that you've done what? Can anybody unmute and tell me what is something really important you should do before you give medication?
Check that the medication is correctly.
Okay, so you're gonna verify these 6 rights for sure. Yep. What else is something really important before you give meds?
Wash your hands.
So you're gonna wash your hands, right? Okay.
Yes.
And if you're going to be applying a topical medication like a cream or a patch or something like that, you're also gonna wear your gloves. So you're gonna wash your hands. The other thing is you need to have all your supplies in one spot. If you know you have an oral medication or a pill, but you also have a topical medication, you're gonna bring both of those to the person so that you don't forget one or the other. So if you have a syringe that's needed because it's a liquid medication, you know, you don't want to be making trips back and forth because it could contribute to an error. You also want to make sure that you've communicated with the person, right? So, and I know you're doing this, but hey, it's 10 o'clock. Guess what time it is? You know, you've got some type of routine, you're communicating about that. And then you also just want to make sure that you've paid attention to any special instructions. You know, there are medications that some can be crushed, some can't. Some need to be given before or after a meal or within a certain period of time. There might be a special instruction that says after you've given this medication that you need to help the person go from sitting to standing because they might become dizzy. So make sure you've read any special instructions before you get into the 6 rights. Okay, first one, right person. This seems like a duh, I know, but as Candy pointed out, if the pharmacy actually delivered the wrong person's meds, right? So you want to catch that. And if you have more than one person living in the home, and we've got lots of roommates, right? We have staff roommates, so that person might have medication. By the way, medication should be stored separately, right, for different people. And then if you haven't heard yet, we're actually getting ready to bring on a couple of new consumers to options. It's very exciting. We have two people that are starting with options February 1st, James and Jordan, and they are roommates. And so that will be one of our first roommate situations where there will be two consumers and they each have medication. So in that home, it's going to be very important that we're checking that it's the right person, okay? The other thing with the person is just paying attention to how that person needs to be positioned in order to take medications. Some people might need to be, you know, maybe they are laying back in their chair, but in order to take medications, they need to be sitting up. Maybe some people, you know, it's better for them to do it in the kitchen or somewhere else. So along with the right person, just knowing kind of their habits, their needs, and paying attention to those things. Then we have right time, okay? This is the right day, the right time of day, making sure you took it from the right slot, right? Because in those medication trays you've got, and they're all different. Sometimes they say AM, PM. Sometimes the difference is the color. You know, sometimes blue is night and purple is night. So, you know, you need to make sure you're taking it from the right slot in the pill box. Now, when it comes to time, we have a window of time in which that we need to have the person take the medication. It's typically an hour before and an hour after. So if the medication is supposed to be given at 8 a.m., it can be given as early as 7 a.m. and as late as 9 a.m. This is something I know that we are struggling with a few people because they don't get up at the same time every day and they don't eat at the same time every day. And maybe the medication prescription that we have just says take it in the morning. So I'm giving you a heads up. I've asked the facilitators to crack down on that and agree on a time. And I know for a couple of people this is going to be difficult. But because we're switching to an electronic medication system that's going to alert you, we have to have a time. And so if you have questions about that, I don't have the time today to help you figure that out, but the facilitators and I have talked about, here's some ways that we can do that. And we may have to make some exceptions, and I understand that. But in general, we need a time. And our new system allows us to have a different time during the week than we do on the weekend. So say somebody gets up early during the week, but they sleep in on Saturday and Sunday, we do have the ability to vary that just a little bit. But it is important that we're taking medications generally at the same time every day. For a lot of medications, it impacts the effectiveness of that medication. So that's one of the many reasons that we need to have a time. Related to time, if you try to give the medication and the person says, not going to happen, don't want it, no thank you. I know this happens, and with some people it happens very often. If it's happening often, I want a written protocol for how we're going to do this. You know, how many times are we going to ask before we say it's really a refusal? Because in our new system, once you mark it as refused, you can't go back an hour later and say, oh, they've decided to take it. You know, once you have indicated the outcome of the medication, it's done. So we need to have some protocol around that. But generally, I want you to ask the person at least 3 times. Sometimes it can be, do you want to do it now or in 10 minutes? You know, instead of saying, do you want to take this medication? Do you want me to come back in 5 minutes? You know, and you have your ways of trying to help people take the medication, and I trust that you are doing that. We always are going to need a reason for the refusal. So you're going to have to try to get from the person why, you know, and if you can't, then you can put in the explanation, asked 10 times, they gave me the bird, I'm taking that as that's their reason, right? I know that you won't always get it. But we do have to document when somebody has refused or declined that medication. And I'll show you where to do that. Okay, the right medication. So you need to verify that what you're handing the person is the right medication for that time. So, like, Candy was saying, and we said earlier, you're not just taking for granted that whatever is in that pill box is correct. So, you're going to have to compare that to the list of medications. So, right now, where you could get that information is hopefully you all have a paper. You might call it an MAR, a medication administration record, or a med tracking form, or whatever you call it, med list. Hopefully you've got some type of paper tracking that you're using. So you need to compare what it says. If it's morning meds, that each medication that's listed, you look on the paper tracking form and it shows 4 medications. You look in the box, oh, there's 4. Okay, which 4 are these? That's a purple one. That purple one is this. And if you don't have that committed to memory, you are supposed to go to the cabinet and open the bottle that says that's the name of the medication and go, yes, it is the round purple pill with the imprint T5 on it. Yes, that's the right medication. Now, many of you are sitting there going, Melanie, we don't have time for that. We know what the medications are. But I'm telling you that it is your responsibility to make sure it is the correct medication. So you must verify, you must know that it is the right medication. So whatever you need to do to make sure of that, that's important. If you have somebody that has a blister pack or a bubble pack, on the label, it gives a description, right? It'll say round, oval, it'll say the shape of the pill, the color of the pill, and it'll tell you what the imprint is. In our new program in QS Med, it also will tell you the shape, the color, the imprint, and there will be a picture, and I'm going to show you what that looks like. So that will make it a lot easier as long as we're keeping the database updated. So you're going to, verify multiple times that it's the right medication. When you take it from the pill box or you take it out of the, bubble pack, you're going to verify. Before you hand it to the person and they swallow it, you're going to verify. After they've taken the medication and you're documenting, you're verifying again to make sure that it's the correct medication. Quickly about medication, if you dropped medication and you're not able to give that medication because it's dirty, it's been dropped, whatever, we do want to make sure that you are putting that in like a Ziploc bag, or if you don't have a Ziploc bag, an envelope, something, and you're labeling what medication is in there and what happened, the date, right? So you're going to put January 6th, dropped medication, Keflex, 10 milligrams. And then you're going to say, where did you get the medication? Because you still need to give it. And that needs to be noted in your daily service note as a high priority note. You guys have seen you have the choice to mark it as high priority. That way the facilitator knows that you had to take a medication from somewhere else, and we're going to need to make sure we have enough and that we address that. Okay, because if we're counting, the count's going to be off, and that's going to explain why it's off. Another thing about right medication is paying attention to the expiration date. Usually when it's a routine prescription, you're getting them, every month, and so it's not as likely. But when somebody's using over-the-counter medication, or they had an old medication that's been sitting around and they want to take it again, and they were given maybe a telehealth, order to take that, you want to make sure that it's not expired. Okay, right dose. So when we talk about dose, a couple of different words. Strength, it's basically the amount of medication per unit. So if the unit is milligrams, how many milligrams? Okay, 50 milligrams. The amount is the number of the tablet, capsule, spoonful, whatever. It's the number. And the dose is the total amount of the administration. So in the example that's on the screen, if the tablet is 50 milligrams and the prescription says that we give 2 tablets, then the total dose of that administration would be 100 milligrams. So it's really important you're paying attention to the number of pills and that the pills are the correct milligram. This is especially important if somebody takes a medication that maybe they take it in the morning and those pills, it's a 25 milligram, but their evening dose is 2, of those because it's something that might cause lethargy and they're going to bed. Or even more important, if they take the same medication, but it's 2 different pills. So like in the morning, it's a 100 milligram pill, and they also have a 25 milligram pill, right? It could be super confusing. So you want to make sure that you have verified how many pills, what the strength of each pill is, and the total dose for that administration, that all of that is done correctly. Another thing related to dose that's important is, if you're doing a liquid medication, it should be measured, with liquid measuring. So like a syringe or a measuring cup, or, the med cup that is labeled with the milliliters or whatever the measurement is. If you're crushing a medication, it should only be because that medication can be crushed. Some medications can't be. So that should be actually stated in the prescription for that medication. And when you're crushing a medication, you want to do it in such a way that you don't lose, right, part of the powder. So there should be some procedures around, crushing those medications and how you do that. Pill crushers are, in my opinion, the way to go, because it's a device that crushes it in a contained area, and then you're pouring that into, the food or whatever you're mixing it in. So the dose is one of the areas where it's really important that you're communicating around changes. So if you go to the doctor and they're not changing the medication, they're not discontinuing that medication, but they're going to increase or decrease the dose, they may not say you need a brand new, prescription, because it's already 25 milligram pills, and instead of taking 2, you're only going to take 1. That communication is really critical because everybody was used to giving 2. Now you're only going to give 1, and maybe the pills have already been distributed for the week, and that now has to be corrected. So if you're the one that received that information, it's so critical that that gets communicated immediately to the facilitator, and that what you see in QS Med has been updated. Okay, right route. This one seems like a total duh, right? If it's an oral medication that you swallow, okay. But here's where I've seen a mistake, because the route could be, is it something that you take by mouth, or is it a topical type thing? It also includes drops. And I have had before where somebody had both eye drops and ear drops, and the 2 were mixed up, and an eardrop was put into somebody's eye. So I know it seems like it's just common sense, but it is really important that you're paying attention to that. And like I said before, if you're doing topical, that you're using gloves, and preferably you're using like a tongue depressor or a Q-tip or something like that. I never want you putting a bare hand scooping into, right, a container of cream, or if it's an ointment, and you're going to put it on your finger and then you're going to be rubbing it on the person's body, you've got to have a gloved hand for that. And you want to make sure you follow the instructions for, how much of that ointment, how thick is the layer supposed to be, does it have to dry before you cover it? There's going to be some instructions that you want to follow. And then the last right is documentation. This originally, if you've been giving meds a long time, it used to be 5 rights, and documentation was not included, but it's been added over the years as the 6th right, because if you fail to check off, and document that you gave a medication, there have been errors where the next staff comes in and sees that it's blank and goes, oh no, Nigel forgot to give that medication. I better give it to them. I'm going to go to the bottle and give it to them. And now they've been double medicated. So documentation is one of the 6 rights, and it is an error. It is considered a medication error if you gave the medication and you did not document, you did not sign it off. That is the same kind, it's considered an error, and it's something that we have to report and we have to follow up on. So another thing about these 6 rights, I should have talked about this probably when we talked about right medication, but we do expect that you're making sure the person has actually taken the medication. So did they swallow it? If you put the medications in a little cup and you set it next to them, you shouldn't go away and go do something else. You need to stay and make sure that you actually see them take the medication. And I know there's a few people that this is a problem with, so we're going to need to have some agreements around that. I don't think you need to be like, open your mouth, let me see, unless the person has, a problem with that. The way I do that is when I've given somebody the medication, I stick around, and when they put it in their mouth, I ask them a question because I want to see if they can talk, right? If they've got a pill, that they're holding, they're cheeking, I'll probably know that in the way that they're talking. So that's a way that I'll do that without being invasive, but you can still see that they've taken the medication. So you are responsible for making sure that the medication is actually taken. Okay, so those are the 6 rights. I expect you to be able to memorize these 6 rights so that every time you're giving medication, it's the right person, the right medication, the right dose, the right time, the right route, and you've documented. Those are the 6 rights.
Can you hear me?
Yes, I can.
What about medications that some medications are prescribed in 2 different forms? Like you might have nystatin cream and nystatin powder, or you might have, something. I've seen stuff that's like the same name and it's liquid or it's a pill.
Okay.
So what is the procedure like if there's times that the person, like if it says they can take either or, and it's like, oh, she's having trouble swallowing, so we can give them the liquid, or it's not an open wound, so we put powder on instead of the cream.
Yeah, that's an excellent question. So what I would say is that the one that they use the majority of the time, I want the order to be written that way so it's clear. Right. And in the special instructions for both of those medications, we should talk about that. But the one that the person uses most often should be listed on there as the regular one. And then the one that they need sometimes we can put as a PRN so that we're able to do that one. And if you have to give the one that's a PRN instead of the regular one, you would hold, you'll choose the outcome of held for that regular one, and then it'll pop up for you to say, why did you hold it? And you'll say, they can't swallow today, use the PRN.
Okay.
Does that make sense?
Yeah. I mean, that's a rare thing, but there are instances where that happens. And so I wanted to, especially with the fact that we have clients that have, different needs.
Yeah, no, that's really good.
Those things come up. And so I was just like.
Yep, no, perfect question.
Melanie, I also have a question.
Yes.
Yeah, in the bubble pack, it says 3 o'clock for one meds, and then there's like 4 o'clock, but it's still in the hour window. So we're putting them together at 4 o'clock because the hour window is still there from 3 to 4. So I'm putting them in one place.
That's fine.
Okay.
But what I will say is I would like us to, at the next medical appointment, to ask the doctor to update the prescription so that they're both at the same time.
Okay.
I mean, we should go back to the doctor and say, you know, you've got one that we give at this time, one that we give at this time. There's no reason they can't be given together, right? And and just say, could you please update the labels and update the prescription so that it's easier for us?
Yeah, because that had been ever since, because it's still on the hour window.
Sure,
So,
yeah, and that is okay. It is when the facilitator enters that for QS Med, they're going to need to, you know, they get to set the time, so they can set both of those at being at 4 o'clock. But eventually, I'd like you to get all of that updated so we have updated labels and prescriptions.
okay, all right, thank you.
Great question.
But the other thing on that one, Melanie, is that some medicines, like, are not specifically like you're saying, to make sure we ask enough questions at the doctor's office.
Right.
I know, like, different, like a family member of mine, another client at another agency, and the client here all take this one medicine that's the same. All three of them have different directions on how to take it. One person was told to take it an hour before any other medicine. One person was told to take it like in the morning and then take the other meds like at noontime or whatever. And then one person was told that they can take them all together. So we need to make sure that if there is a reason why you can't take it together, that we need to be like, is there a reason why that pill is being given at 3 instead of 4? Because maybe it's like, well, I know like here with a bone pill, she can't even eat or anything for an hour after she takes it. So
and that's you know, one of the reasons why I say I want us to go back to the doctor and say, hey, you know, this is the way they're taking them. Is that okay? And if so, let's just get that in writing, because the doctor may say, no, that's too close to this other medication, or that's because of when they eat or whatever. So yeah, very good point.
And with,
Yeah,
and with her, we're going to have to go back to, we're going to have to go back and figure out everything as far as times and make up our times on when she's going to be taking the medications, because right now it's willy-nilly. So, and with this new system, we're going to have to figure out if it's going to be 2, if it's going to be 12, and she's going to have to be awake and raised up and all.
Right.
Yeah, just so you know.
But I mean, like, the way I was thinking about that when Melanie said that, and it's like basically right now, if you're saying morning and night, it's usually at least 10 hours apart. And so if she's getting up at 1 or 2 and taking them, then she's up 10 more hours so she can take, and that's usually what she does. She takes it.
Getting it at like 2 in the morning or whatever it is, yeah.
And so if you just go ahead, Melanie.
The problem with that is going to be, with our new system, you don't have the ability to vary it from day to day with that time. So it'll, you know, if you don't give it and sign off by a certain time, it's going to alert you for a long time. And then if it doesn't get acknowledged by a certain time, it's actually going to alert me. And so,
no, but that's what I'm saying. Like, if we set it at 2, then we're safe, because we have, if she gets up an hour early, if she gets up an hour late, and then we have that 10-hour window, 9 to 10 hour window before she would take them again, and she's still up. That's what I meant.
So you're setting it for the latest possible time.
Yeah,
however,
like 2.
I would, for my sanity, I guess, and my confidence, like a telehealth appointment where the doctor knows that she sometimes that's the way she's taking it, and that there's not a, you know, from their opinion, a danger to that. I would really like that, because and if the doctor says there is a danger and she still chooses to do it that way, then I need to make sure that's in her ISP, that it's documented, the regional center knows. You know, a lot of this is just making
may eggs pa doon sa ibabaw. Marami pa sa dulo niya.
I'm not trying to take away her right, but I'm trying to protect her and protect us.
Right. No, I understand all that.
Yeah. Good. Really good observation.
I mean, and the other thing that I don't know if you specifically mentioned on it, but like, we also need to be reading, like, it doesn't always say on the label, like when it says take twice a day, but make sure that we're reading those little tiny labels that are on the bottles and the bubble packs.
Yep. Yeah, for sure.
that we're documenting that in there, because there's like some specific meds. I can't think of what they are right this second, but you cannot take them with grapefruit, anything grapefruit. You can't take them if you're going to be in the sunlight. So you have to make sure that those are documented. And if the person is going to be in that situation where they have to take their meds in the morning, but they're going to be out in the sunlight all day, we have to figure out how we're going to adjust that.
Right. Yep. Yep, for sure.
Because like we take things for granted. Like I don't ask somebody if I can go to the store and buy Pepto-Bismol and take it because my stomach's upset or whatever.
Right.
I just do it. But here we have to have all that documentation, so we have to make sure that like we plan ahead if that happens. Or okay, today she's going to school, so she's up early, but normally she doesn't take her meds till 1. So
Yep.
is it okay that if she's functioning early that she still doesn't take her meds till 1?
I mean,
You know?
that's the, yeah, and that's why I want to ask the doctors those questions. So I'm not pretending, to have that.
No.
Yeah.
I'm just saying those are all things that
Yeah,
you
that's
can't
what
take
we're
for
gonna have
granted.
to ask them and find out for sure.
Yeah.
All right.
We
Excellent.
will. We'll work on that.
Yep. Okay. So hopefully
Me-
everybody is.
Melanie,
Yes.
Melanie, I have a quick question. So what if we are not and this is kind of off or far back, but like when the consumer goes to medical appointments and we're not the one who takes them, usually maybe his parents takes him. So then we are getting information from what the doctor provided for them so that they can tell us what we need to do. So we still need to document that, right?
Yes, you do. And we should have an agreement with family members that we still get the aftercare instructions, because everything, that they were told should be in those aftercare instructions. So
right, they're pretty good about that, but I just had to ask that question because 9 times out of 10 we're not the ones taking him to his medical appointments, but like we may take him to an allergy shot or something like that. So even with allergy shots, do we need to document that too?
Yes.
Okay.
Allergy shots, routine blood work, I want that documented as well.
Okay. That was my question. Thank you.
Yeah,
Melanie, I have a question too.
Yes.
It's also important too that everything is put onto the client's calendar. Every appointment, everything that is due to be done, so that we can check with the client as well as the other staff and make sure it was done.
Yes.
Because I know in the past it's been a discrepancy.
Yeah, and we, in QSP, we do have, I know everybody has like their own system, and people are using, some people are using a dry erase calendar, some people are using a planner or whatever. But we also have the ability in QSP to log an upcoming appointment in QSP, and it will show up on the calendar. So that when you are clocking in, clocking out, and you go into QS Mobile, you can see that there is an appointment. So there's a few different ways, I'd love us to take advantage of, that piece of technology as a backup system to whatever the individual is using. But very good point. Okay, hopefully everybody is back and we can go into our next section, which is QS Med. So first I want to acknowledge that some of you have already gone into QS Med and cruised it a little bit and taken a look at it. You have access to it now. When you, as what I'm showing right here on my screen, when you go, you have the choice of mobile, med, and then you also have one more choice. You have your clock, right? QS clock. So what is in med right now could be inaccurate because we're not launching med, QS Med, until February 1st. So we're doing the training now so that you have a chance to go cruise, learn, and we have the chance to make sure that everything in there is correct. More than likely, what's not correct is the times. Hopefully that's all it is the time isn't correct. But I do want you, after we do this training, I want you to go check out med. And if what you see in there is not what you're giving, call your facilitator and say, hey, here's what's in there. They might say, oh, I just haven't updated that yet. Or they might say, really? Because what I have is this. And then you guys need to figure out what's supposed to be happening. So I have had some perceptive people that when we launched QSP and QS Mobile, you know, they called right away and said, hey, what I'm seeing in med isn't correct. And I appreciate that. We just were trying to give QSP to you in modules, right? Because, you know, it was an adjustment. And so people are doing a great job with QS Mobile and QSP, so we're ready for med. Mike?
Yeah, I just wanted to just say that in one of my situations, we actually have multivitamins and different vitamins and minerals and stuff that have been actually ordered from the doctor.
Okay.
But in the QS, I've noticed that they've kind of been pushed back into like a PRN role when we need those on the MAR. So I need to know how to figure that out. Just maybe you'll cover that now, but I just wanted to let you know, just so you know.
Well, it's actually something I'll cover with you because it's a data entry. It's not something that you control from QS Med. You have to enter it, Mike, on the back end, and you just have to uncheck it as a PRN, and then that one drop down, take off PRN there. So I can walk you through that and make sure we do that. Great question. Okay, so what I'm going to do is I'm going to show you a video about QS Med. So it's going to walk you through the steps. And then after the video, I'm going to go screenshot by screenshot by screenshot. And that way I can answer any questions and talk about each one of them. So we'll watch it and then we'll walk through each one.
That's pretty extensive. I like it.
Mm-hmm.
Yeah, I like the part where it rejected the availability of the volume being taken like a second time.
Yeah.
Yeah. So QSP, if you haven't heard this before, this software company was developed specifically for the needs of supported living. So different than like ERSP or some of these other programs that serve lots of different types of facilities, day programs, nursing homes. QSP is only here for SLS. I mean, somebody else could use it, but it was designed for our needs. So it is very intuitive. And our sister organization, Compass, helped design the software, and actually just official about 5 days ago became the sole owners of QSP, which I'm really excited about because now we have a lot more input into changes. So if we want to make an improvement, we are the owners, of the software company, so we can decide what's important. And so anyway, I'm looking forward to that. So let's go through a few of these things that we saw. The first is, I'm just reminding you again that even though you're giving, medications electronically, and you saw it gives you a lot of information, great information, picture of the medication, all of that, you still have to verify, right? The 6 rights: person, time, medication, amount, the route, and the documentation. So the first part of it is, when you go in, you'll need to, anybody that you're working with that day, you will only be able to access medications if you're on shift, right? So if you're not on shift, you can't go in and acknowledge for somebody else's medications. So, this person, when they log in, they're apparently working with 2 people today, Allison Cooper and Lady Danger. One thing I want to point out, I don't know if you guys can see this, but right here under Allison Cooper's name, during this shift, there are 6 meds that are supposed to be given. So that's an additional check for you. Lady Danger has 2 meds for the time that you're working that are supposed to be given. So you're going to select that client, right? The person that you're working with. And it showed this in the video, but it went over it kind of quickly. There is a color coding. And this is to kind of mimic in the pill box how, morning is usually one color. So if the medication is going to be given between 3 a.m. and noon, basically, it's going to be yellow. So that banner is going to be yellow. If it's scheduled between noon and 6 p.m., the banner is going to be green. 6 p.m. to 9 p.m., the banner will be blue. And 9 p.m. to basically 3 a.m., it will be purple. And if a medication hasn't been acknowledged, it'll show up as red. So if you're the next person coming on, you can view that history and see it's red. And you could reach out, to the person before you and say, did you give that? Or reach out to the facilitator. So there are outcomes, we call them outcomes for the medication that when you're acknowledging, you're going to have to say what the outcome was. They took it, so you're going to click, taken. You held it, and like this, I'm going to just say David, at David's house, there are times because of his bowel health that a medication does have to be held. And so that's appropriate in that situation. If the person refused, that's the declined. Natural support means that they, for example, on Christmas, we had consumers that went with their family for a period of time, and their family was responsible for giving the medication. But you are the one, that was on shift, so you could acknowledge and say they were with natural support. Same thing with day program. Some of these will require a comment. If it's held or declined, it's going to ask you to put in a comment for you to explain why. So then once you've said, okay, they've taken it, so the outcome was taken, you'll have to select acknowledge, and you'll give you a summary. So this is another 6 rights check for you. So this is the ones that I said were taken. Yes, that's correct. And then if you recorded your signature, then it automatically does that. And it does timestamp it. So just so that you know, it does timestamp when you acknowledge it. And if you've acknowledged it at a different time than it was supposed to be taken, that's actually a report that we can look at and try to figure out why is that happening. So you'll acknowledge the summary, you'll do your signature, and then you'll hit submit. So then here's just, a closer view of some of that. So here's the outcomes that I was just talking to you about. You do have the ability to make a comment. Right here, it says, it has this bottle. It should be an actual image of the pill. And so we're gonna have to go through a process of making sure that gets in there, and we'll talk about that. If you click on view image, you'll get the up close version of the pill, and then it has all of the information, including when this medication was last taken. Okay, so you get that information. Question, Carrie.
Yes, I did mention to Mike the other day, or yesterday actually, that sometimes my client will get a pill that comes in a certain form or a certain look, but then when we reorder it, it comes looking differently, even though it's the same dose, same pill, same everything.
Yeah, so a different manufacturer probably was used.
Yes.
So you have the ability, I have given, so I have to set up everybody's permissions, and I have given all of you the permission to be able to upload a new picture. So that doesn't have to be done by the facilitator, but I would like some communication with the facilitator.
Absolutely.
Absolutely.
Okay. Every single time we'll update it.
Yeah. So you pick it up, and usually the pharmacist tells you, hey, it might look different than the last time. So then as soon as you get home, you can either with your phone or with the iPad. It's very easy, actually. You basically just tap you're going to navigate to the RX. It's in a different window than this, but you tap on that empty picture or on the picture that's there, and it gives you a choice to replace the picture. And I actually am going to share a few tips about taking pictures of them, and I'm going to give instructions to the facilitators for that, so that we can make sure that happens. So great comment. So just going over the PRNs. So the PRNs show up technically in a different place because a PRN it's not already scheduled, right? So when you clock in and you go into med, it shouldn't be there as one of the things you're administering because it's not already scheduled. So up here, you actually have to go into this different place. You go into the PRNs. And then you can, give a reason for why you had to give it. So like the one they said is the person was in pain. I'd love a little bit more information, like, was it a headache? Was it a stomach ache? Is it related to something? How long were they experiencing it? I'd love just a tiny bit more information than what that video gave. And it does have when we enter the PRN, if it says max every 4 hours, or it says max this many times per day, QS Med automatically calculates the last time the PRN was given and makes sure that you're within those intervals. So it will decline it for you if you can't give it. But you could obviously call the facilitator and you guys could figure out what to do depending on why that's happening. So when you click on view image, it enlarges, right, the image of the pill. And in this picture, you can actually see the imprints on the pills. And I want to clarify for you that the way we're going to upload pictures is we're going to have, it'll look like this where there's 2 pills, but the first image, or one image will be the front of the pill. And the next image that right next to it is going to be the back of the pill. That does not mean they take 2 pills. We're just simply showing you the front and back of the pill so you can correctly identify it. So when you look at the picture, if they take 4 pills, there's not going to be 4 pills in this box. This is just so you can correctly identify which pill it is. You have the choice, to see additional details about the medication. So this just gives you an example, if you want to see it, it's all there behind anyway, but this just makes it a little bit bigger for you. For those of us that can't see very well, it's very helpful. And you can also look at the special instructions, all those things can be made larger so it's easier for you to see. So here's the thing that we are going to have to get used to. So right now, there's nobody bugging you, except for maybe the consumer, right, about when it's time to take medication. But QS Med is now going to bug you. So right now, this is the way I have it set up. I might make some tweaks to this, but this is the way I have it set up. You will get what we call push notifications on the iPad or the tablet that's in the home and your phone. So if the medication is supposed to be given at 6 p.m., let's say, 15 minutes before that, you will get the first reminder. And you will then get a reminder every 10 minutes until you acknowledge that medication. And this is something you want to be informing and prepping your folks about, because it's different, right? The iPad's going to start making noise and your phone's going to start making noise. This is also the reason that your iPads in the house need to stay charged, need to stay on, need to be working. If you're having problems with them, please, please, please let us know so we can get that fixed. You can do all of this from your phone, but I want multiple systems to make sure, right? If one of those are silenced, hopefully the other one's going to bug you. This is all just to help us prevent any type of medication error. You cannot hit snooze, by the way, right? So if you haven't acknowledged that the medication has been taken, there's no snooze feature. It's going to go off in 10 minutes again until you acknowledge it. If you haven't acknowledged that the medication has been given within 45 minutes of the time it was scheduled, then what we call emergency on call, emergency pager, whatever you want to call it, basically every facilitator and me is going to get a warning, right? And then one of us is going to hunt you down and say, hey, where are you? You're gonna be like, I'm at Charlie's. Well, how come it says you haven't given the medication? Oh, I have, I'm cooking and I have stuff all over my hands and I haven't had a chance. So I want to prepare you. This is what we're going to say. Stop what you're doing. Go acknowledge the medication while we're on the phone. We're not going to say do it when you get to it, because there is a very set window of time in which you can acknowledge it, and then you will be locked out. And that's for a reason, right? We want you to acknowledge it right after the medication has been taken. The reason it's 45 minutes is that still gives us time within that window to prevent a medication error from happening. If you're having connectivity issues, right, because we're going to an electronic system, the iPad is not working, the internet is spotty, something like that is happening, you're still responsible, for administering the medication. So I'm asking the facilitators to have a backup list, a paper list in case that should happen. But what I've, in other agencies that are using this, you guys kind of know with the connectivity in your homes, like if I go outside and stand, or if I stand in the kitchen and hold my phone like this, I get reception. So if that's what you have to do to acknowledge, then I want you to do that. But as a backup to this, in your direct service note or your daily service note, you can acknowledge in there that you had a connectivity issue, but you did give that medication, and you can mark that as high priority. So we know, when we get these alerts, and because the facilitators and I every month will have to run a report that shows any gaps, and we will have to explain every one of them. Because when we get audited, the regional center can't go to your paper and see that you signed off. They'll only have this electronic system. So if you didn't acknowledge, we will have to put in that report what happened. And if you put that in your service note, that will help us with that backup documentation. It also, if you're having connectivity issues and you can't acknowledge, your facilitator or I from a different platform can acknowledge for you. A coworker cannot do that for you, but somebody with a different security role can do that. So if you FaceTime your facilitator and say, the iPad's dead, my phone won't acknowledge, I don't know why you wouldn't, between the two be able to do that, but for some reason I can't. Look, see, he just took his medications. The facilitator can go through the back end and acknowledge for you. So we do have some backups, okay? So that is QS Med. Any questions so far? I know you're gonna have to get in and play around with it, but any questions so far about QS Med?
On the alert, is it going to alert us because for my consumer, he takes at least 7 to 9 meds each time he takes meds. So is it going to alert us 7 times for each medication?
No, it'll alert you one time for that time, right?
Okay.
Yeah, so that's a good point, because we have a couple people that take like 20-something things, like, ding, 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 ding. Yeah, no, good question. You'll get an alert that says it's time for, and actually if you look on here, this one says ladies 1 medication. If it was 7 medication, it'll say John's 7 medications.
Okay.
So it's pretty high tech. I love this program.
Yeah, I like that.
Okay, so you're gonna need to go in and start, playing around with it, looking at it. If you accidentally acknowledge a med right now, don't worry about it. I'm not tracking it in January, but we are launching it February 1st. So in February, I'm gonna ask that you use QS Med and you also use whatever paper tracking system you're using currently. Because I anticipate there's going to be some bugs, some issues that have to be worked out, and I want to make sure we've got proper documentation. And then after February, that month of working out those kinks, in March, you will no longer have to do both documentation. It will just be QS Med. Okay, I think there was another question.
I have a question, Melanie. This is about iPads and phone. So there are times the iPad is so slow and it's saying us like there's an alert. It says your iPad needs to be backed up. And then are we always free to just do it on our phones because it's quicker and easier for us to do those medication, the QS Med?
Yes, that's a really good question. My first response is I want to help you with those iPad issues because I want your iPads to work correctly. So, I have already replaced an iPad. So if we need to do that, and we do have a tech person. So that's my first thing. Make sure the facilitator knows and we're trying to address that because I don't want it to be annoying. I want your technology to work right. But the second is, yes, QS Med is part of mobile. Right? So you can use your phone to do that. Great question. Okay, I want to just quickly go over just a process, right? Whether you're using a paper or QS Med, this is the process I want you to make sure you're using. So you've washed your hands, you verify the 6 rights, you give the medication and observe that it was actually taken, then you double check. Go back to the box. Oh, what's this pill stuck up on the side? Why is there still a pill in there? I thought I gave that pill. What happened? I better figure that out. Double check the blister pack. Did all of them fall out when you did that? So you're, even after, right, before you document and acknowledge, you're double checking. And then of course you're going to document immediately. So this is just the process that I'd like you to go through. I have some old pictures on here, but a couple of them are useful. So I'm going to go through these really quickly. I just want to point out a couple of things, right? So when I'm talking about the pill boxes, that's this thing up here that I'm talking about. So you need that if that's where you're getting your meds. Here is your phone, right? Or the tablet, because you're going to use QS Med. This is something that I'm not instituting for you all because you're current employees, but when we hire a new employee, we're going to start using something called an intensive medication administration checklist. And for their first month or so that they're working, I'm going to ask them to verify every right when they do it. And it's just to help people get in the habit of doing it. So I'm just letting you know this is something new we will be instituting. Here is a medicine cup. You know, maybe you use something like this. Maybe you use a Dixie cup. Maybe you put the medication right into the person's hands. I don't know, but you might have a cup like this. This other contraption, I just want to show this to you. I really like these. If you want this, I will get it to you. I have these. Our sister organization had them printed up with their logo on it, but I don't care whose logo is on it. I'll give it to you if you want to use these, and I'll show you what it's for. So, you know, you've got your, these are actually jelly beans, but you've got your medication, and this is a counting tray. And you take what was in the box, oops, sorry, and you put it in the tray on this right-hand side. Then one at a time, and it comes with this little hockey stick looking thing. Here's the first med, and I'm going to verify what med that is. Once I've verified, you know, by looking at QS Med and looking at my checklist, if I have that, and I know that's the right one, I'm going to push it over here into this left column. Okay, what's the next med? Okay, the next one is this yellow one. And now I'm going to verify, right? And as I verified them, they go over into this left-hand side. And then this cool little compartment closes. And then you can take this whole tray and dump it into the cup. So it's a way to sort your meds, count your meds, check your meds without ever touching them with your hands. And so if, like I said, if you guys want these, I'll make sure they get out. Let your facilitator know, and we'll get them delivered for you guys. It's just super handy to have. This was, we didn't have time to do this, but if we were doing this training in person, which I hope eventually we'll be able to do. And by the way, this exact training will become part of orientation for brand new employees. So one, I'm sorry that some of you have been here probably 10 years, 5 years, however long you've been here and never had a training like this. So we're fixing that. But new employees will now get this training as part of orientation. And when I can do it in person, they'll actually have pill boxes like this, and we'll have QS Med set up, and it'll have a picture of these jelly beans, and they'll need to go and do basically a practice med pass. And if you're looking at these pictures, hopefully you've noticed that there's a difference, right? So over here, this pill right here, this yellow one, is different over here. It's orange over here. So when we have the chance to actually practice, I'll set up pill boxes incorrectly, and we'll practice catching those errors. So just kind of letting you know that's something we will be doing. Okay, so really important, I need to cover medication errors. And I am looking at the time. I know we don't have very much time left, but this is important, so I want to make sure I cover it. Okay, a medication error is if any of those 6 rights were wrong. Okay, if any of those 6 rights didn't happen, it's technically a medication error. So what do? If you've made the error or you've discovered somebody else's error, either way, you need to pick up the phone and call your facilitator. Okay, if it is they're not, you know, getting back to you, it's late at night or it's on the weekend, you can try calling the emergency on call. You can't get them, you can call me. We have to know about an error for many reasons, you know, because we're going to need to call the doctor or the pharmacy to figure out, do we give this late? Do we hold it? What do we do? Is it a medication that could have a serious impact because it wasn't taken? If we happen to give double the medication, should they get checked out by a doctor? Right? There's all those questions. So that's really, really important. The next is that we'll ask you to complete a field incident report, and that's this picture over here. So in QS Mobile, you can access the field incident report, or FIR. And so you're gonna fill this out, and if on the field incident report, if you say that yes, it was a med error, it's actually gonna bring up a whole nother set of questions that give us the information we need to figure out, verify it is a med error. And if it is, we actually have to do a special incident report to the regional center, and that actually goes to DDS, the Department of Developmental Services, as well. So this is something we're going to trend and track so that we can try to prevent these errors, make sure that this training helps with that, figure out how to make sure we're doing a better job around that. So, you know, just a couple of things that I've learned over time contribute to medication errors. Distractions. You know, you go to start giving the medication, and then, you know, somebody's asking a question, or there's noise, or there's something going on. The most common, I think, is just neglecting to do it at the right time. So hopefully QS Med will help us with those reminders. Another cause of error is filling the medication box incorrectly. Something that has happened that's going to be really critical with QS Med is that the medications didn't get updated. So there was a change, right? A change in the dose, or a change in the pill, a change in the time, and we didn't get it updated. Another error is, you know, you are going for a day trip, or you're going out for a couple of hours, and you didn't remember that you're going to be gone during the time that medications are supposed to be given, and you failed to bring them with you. You know, those are all some reasons that medication errors happen. So a couple of recommendations. One are all of the things in this training, right? Slowing down, being methodical, you know, having a good process will really help. But also at shift change, right? When you're getting ready to leave, go double check your work. When you're doing your daily service note, go double check your work. I would much rather you find your own error, okay? When you come on shift, I want you to look. If you go to give medications at your time, and you see that there's pills left at the time before you, or in the day before, I need you to call. If you come on shift, you go check, and you see that, let us know right away. Sometimes it's not a med error. Like, we could be within that window, and we could prevent that. Help each other out. Okay, be looking for that. I will tell you, the facilitators can tell you, something I get really irritable about, like I get really mad, is there was an error, and it happened 3 days ago, and the pills have been sitting in the box for 3 days, and so 2 or 3 other people have come on shift, and nobody called and said. So I get mad about that for 2 reasons. One is the chance for us to prevent a problem for the consumer is past now, right? So we weren't responsive to that error. And second, now I'm in violation. We are in violation of our special incident reporting procedures. We have to report that within 24 hours verbally, and follow up with a written report within 48 hours. And the regional center will call me every time and say, what is your problem? Why didn't somebody notice that there was an error? And they're right. So please, even if it's not your error, even if you think it may have already been communicated, you see something is not right, pick up the phone and call and let us sort it out. And we'd rather have 3 repeat calls about it than not have a single call about it, okay? And I know we're over time, we're right at time, but I'm almost done. Okay, when I send you, I'm gonna send you an email. It's probably gonna take me a couple of days because it's gonna be, I forget what they call it, but the format of the email has to be different because it's going to have links and, you know, I have somebody that helps me with that. It's gonna be all pretty. You will get a link about this form. It's called the Medication Administration. I'm sorry, I got ahead of myself. This is the reflection form. When you make an error, your facilitator will need to meet with you and talk to you about what contributed to the error. And they're gonna ask you to fill this form out. So you can go back and reflect and try to figure out what was the problem. And if you are responsible for a medication error, we will do a written reminder. We will put it in writing that we've gone over this reflection with you and we've tried to figure out how we're going to prevent it from happening again. We simply cannot have repeat medication errors, so this is part of our process, okay? This is the form that I jumped ahead about, sorry. So it's the Medication Administration Responsibility Statement, and this is new. And it is a acknowledgement on your part for what your responsibilities are. I feel like this is just really critical to have. You are helping somebody with medication, and you know from your own personal medication what a big deal that is. You don't take medications correctly. If you mix the wrong medications, I mean, we are sharing responsibility for somebody's health and well-being. So I feel like we have to have a statement that you say, I get it. These are all my responsibilities. So these are the things we've covered in this training. And so I'm going to attach this to the email, but I will probably send this to you in a DocuSign so you can electronically sign it and send it back to us. If that doesn't work for you, if I have to mail it to you in a self-addressed stamped envelope, I'll do that. You know, COVID's making it a little crazy to do that, but I do want to get a signed acknowledgement from everybody. Okay, that is all the material. 2 minutes over, not too bad. But let's talk about, or 3, just went to 3 minutes. Any questions? None?
I had a question, Melanie.
Okay, I think it was Kristen.
Yeah, Krista here. Yeah, so you said we can start using this right away, right? Start practicing with it and filling it in as when we're doing shifts.
Yes.
Right.
Yeah, you can. And but the important thing is that you're doing both, right? You know, because it may not be right, and you might find some discrepancies. So let your facilitator know.
Right. Okay.
Yeah, as soon as I can get everything loaded up, we're going to make sure we start right away, you know, so that way we can get some practice in.
But it is actually available to you right now, so you could click into that right now and see what's there.
Or some things that are going to, you know, need to be updated. There's a couple of situations I have that are going to be updated. So, but yeah, definitely you can start using it.
Okay. Yeah, I actually just clicked on it while we were talking here, and looks like it's there.
Great. Okay. I think Rita. I know there was a few, but Rita, go ahead.
Okay. You was talking about there are some mistakes I already looked in there. I'm nosy. That's just me. There are some mistakes on marks that we do need to correct, Bruce, and I really need to get with you as soon as possible so we can correct these mistakes, Bruce.
Awesome. We'll do that. Thank you very much for noticing that.
Right.
Well, one of the things was there's a change that I was telling Melanie about in terms of moving the time later since he's not going to day program. So that's one of the things I hadn't talked to you about. We were talking about that some as a team.
Okay.
But yeah, I need to update all my, they're not all completed.
That's a very common, most of you are going to find there are some problems with times because a lot of the previous documentation, it was a little loosey-goosey, right? It was like, oh, it's morning. Oh, when they get up, or, you know, every day is different. And so you're going to probably find time on a lot of them need to be corrected. And so you guys as a team are going to have to figure that out. Yeah, I think there was another question. Or maybe not.
I can add something potentially. So isn't it true this isn't just Compass and Option saying, oh, we have to really do it at this super high level? Actually, what's happened is State Department of Health has really gotten on the regional center about these medication issues.
Yeah, these are, that's why I was explaining that when we do a special incident report, it actually goes to DDS. So they, there are few communications about a provider that go to DDS when you start and when you end, and then these errors. And I would rather not have that be what DDS knows about options, right? But yes, Bruce, this is not only us. It is, you're probably feeling a little bit of push on our end to clean up some things and just to be a little bit more consistent and reliable and more standardized, which I think probably 99% of you appreciate, because when you know what's expected, you can do that and you can exceed those expectations. But when you don't know what's expected, it's very stressful. So I don't think anybody's going to have a problem with it, but this is expected of all agencies. Just some are a little bit faster to respond or a little bit more structured than others, if you will. Okay, so you get paid for today's time, and we will have to add this to everybody's calendars, and I'm going to have to talk with the CSFs to figure out how we're doing that. Mike and somebody, did you guys get everybody before I end this? Did somebody copy the chat? Take a screenshot?
I wrote down names that I saw, but if anybody did not type your name into the chat earlier, do so now, please, because
Yeah, I've got
that's what I'm basing it on.
on there. There are a few people that's names are like iPhone. I just need to make sure.
Exactly.
Yeah.
Oh, LG Stylo 6.
Yeah, I got Joe Kinwa. I got him. I've got, I need an LMX320. There's another.
Tiffany is one of the silos. That's me.
Okay, great. Hi, Tiffany.
Thank you.
I've been here the whole time, just not on video.
That's good. Good to see you.
Glad you made it.
Oh, and
Melanie, I did notice that some people were on here and then left within like an hour.
Okay, so there was one person that contacted me in advance and said they were on shift, and I gave them permission that if it became too distracting or the person said, no, this isn't working, that they could leave and that I would be sending them the recording for them to fix it. And some of you will notice, right, this isn't all of our staff. So anybody that missed this, that's why we recorded it. I preferred people be here because, you had these questions, right? So that made the training so much better because we could acknowledge your questions. But every employee will have to watch this recording. And, your facilitators are going to follow up and they have a set of questions that they have to ask you, whether you were here or whether they watched the recording on their own to verify that it was done.
Oh, and also one more thing, Melanie.
Yeah.
The pill counter that you was showing.
Yeah.
I think that is a very good idea for at least all the consumers to at least have in their house, just for safety. That would be a great thing.
I will figure out a plan to get them out to everybody. And I will say that I know there is at least one consumer, and Audrey's picture just showed up and it made me think about it. Audrey, and your beautiful hair. I love
Thank
your hair.
you.
Anyway, that we actually do not assist in medication. And so, but I still wanted everybody to go through this because it's possible you'll support somebody else.
Yeah.
Even if we are not helping them, I want you to still help them in any way that you can, and you already know that, right? And I know that's hard, and not everybody is able that, but I wanted everybody to do it so that you knew what kind of the guidelines were, and then you know how far off we are in those situations, and of course we'll have to figure out how to address that.
I have a question, and I didn't ask sooner because I just wanted to see if maybe it was answered within the Zoom itself.
Yeah.
But so for Jess, we don't report anything with her meds, obviously, because we don't help. She signed off on that. But what about her appointments? Do we have to like say what kind of appointment she goes to? Because she had 2 yesterday, and I just had doctor's appointments because I don't know how involved I'm supposed to be. She don't let us go in.
I know. So we need to,
oh, go ahead.
well, we need to have a conversation with her because there is an expectation that when we do our monthly, quarterly, and annual, that we are reporting on that. And so
Yeah, so I still put as much as I can in.
Yeah, that's helpful.
In my notes.
But what we can do is, you know, I mean, if we just have to get in writing that she's refusing, you know, to give us that, and then she's responsible. She becomes responsible for reporting that. But I do appreciate you putting as much detail in there as you can get away with, so that we're aware.
There's certain things where I'm like, I don't know if I should mention or not. Like yesterday, she got a new psychiatrist.
Yeah, everything that you're mentioning.
I spoke to Mike about it, but I didn't really type it into QSP. I just make sure that it's communicated. At least, I mean, with Mike, we can trust that it'll get noted.
Yeah, thank you. You're in a tough situation. I appreciate your flexibility there.
I was just gonna say that just so that you know, I've been actually inputting. I finally got all of her doctors in there. I finally was starting to hear about appointments, so I'm doing it as I hear about it. You know, so if you give me information, I'll put it in there.
Great.
Yeah, you'll probably hear about today too, because she wasn't too happy that I had to do this.
Yeah.
And it insinuated that I could possibly work with someone else, and I was just kind of like, well, I do work for Options, so I have to follow their rules.
Yep.
Have her call me. Okay. Any other quick questions? I know some of you probably need to go, but any other questions I can answer?
I just one other last thing, Tristan here. Just I guess it looks like when we're doing the med check on the QSP med thing, it looks like it's gonna be pretty quick. Just like check, take, and then acknowledge once everything's kind of all set up in there. It really shouldn't be too involved, really.
That's correct. Mm-hmm.
Okay. It's only if there's like changes or errors or something, that's when there maybe is a little extra stuff. But
Yeah, and really the heavy lift is right now on the facilitators to get it data entered. That's
yeah, I know we sat down for like a half an hour the other day going over all the meds and everything.
Yeah.
So, cause I've been helping John with that for so long.
Yeah. Oh, and what I didn't go over, but I will send out to any of you that are going to be taking pictures, is some guidelines for taking pictures, just in terms of, it's simple stuff. If it's a white pill, put it on a dark background. Plain piece of paper or plain piece of fabric, you know, so we can actually see it. So I do have a guideline for how to upload those pictures, because that is the only thing we need help with now, is getting all of those pictures in there. And like I said, you all have permission to do that. It is pretty easy, right? You just click on it and you follow the prompts. But so I'll send that out. Make sure I send that out, those directions. Yeah, Joe, you're on mute though. Unmute yourself.
Since team has one medication that was pushed from afternoon to very late afternoon, like 9 p.m. So can I just leave it as afternoon and just talk to Christine about it, or how do we go about that?
So you're saying the med can be given anytime between afternoon and 9 p.m.? Is that
No, it's specifically at 9 p.m. But on the QS med is showing afternoon with the other meds.
Oh, yes. So talk to Nigel, and Nigel can get that changed so that it shows up correctly.
At 9 p.m.?
Yeah. If you look in QS Med and any of those times are wrong, doses are wrong, anything is wrong, let Nigel know and he'll get that fixed.
Okay.
Yeah, I'll fix that for you.
Okay.
All right.
And Nigel, can you check on the morning med? That one, furosemide, I don't think is showing on the system. I think it's only
Okay.
that. Yeah.
All right, sure.
Thank you.
right, guys, I need to get going.
Yeah,
Bye, everyone.
thank you, everybody, very much. And we'll make sure this gets put on your schedule to reflect the time. Appreciate you all. Happy New Year.
Happy New Year.
Happy New Year, Melanie.